You may be wondering why you should consider surgery versus staying on medication for the rest of your life. Well, one thing I can tell you is the black box warnings for the reflux medicine really has a limited time span, 4 to 8 weeks, that you may consider being on that medication. Most of you have been on medication much, much longer than that. Now, it's my belief that these medications, when you compare them to other medications, are fairly safe medications, but there are some downsides. There's a downside to almost everything. And I'll just go through those, and then I'll come back to even another more important reason, in my opinion. But the downside to the medications are several. They reduce acid in your stomach. That's one of our first steps in the digestive process. In my opinion, important. It's important for proper digestion of protein. That's important to our body function. It's also important to these kind of medications have an effect on the bacteria flora that is working in concert with the rest of our body. We need these many trillions of bacteria that are in and on our body to help our body function and be in balance. And medications, including the medications that reduce acid, often can further throw that bacteria flora a little further out of balance. It's also been an association between hip fractures and osteoporosis and the medications that reduce acid in your stomach. One thing that is rarely discussed is that when people have reflux, those juices can get into their lungs and cause pneumonia. The kind of pneumonia they get because they've been on acid-reducing medications can be very difficult to treat. It can be bacteria that is resistant, and often pneumonia is even more severe. The thing that concerns me the most about medication versus surgery for reflux is medication does not treat the reflux. Medication reduces acid. Acid is the thing that causes the most pain when it comes up. It also causes the most damage, but there are many other juices that come up into the esophagus. Those juices most likely are causing the rising incidence of cancer of the esophagus. So the juice is still coming up, even if you're having no pain or discomfort, and even if the heartburn's gone away, you're still having reflux because that one-way valve is broken. The only thing that fixes that one-way valve is surgery. So factor that in. If you have reflux, and it's likely you're going to have to be on medication for a lifetime, and you're in reasonably good health, reflux surgery is a very safe operation when you compare it to other operations. You may want to consider surgery.